Aesthetics. And all branches of aesthetic medicine and surgery have their roots in the human psyche. The human psyche is complex, part nurture and part nature. Our nature is ancient. Hey, it's Marco Pelosi III. Understanding the nature of our psyche helps us to make sense of things that don't appear to make sense on the surface. In April of 2016, I helped the members of the New Jersey Obstetrical and Gynecological Society do just that when I exposed them to their own nature and showed them how their own nature explains cosmetic gynecology completely. Let's take a trip back in time. It's way too early on a Saturday morning. We're in a conference hall in an old part of Atlantic City, in an old hotel, surrounded by 400 skeptical academics about to have their minds blown. Good morning. Thank you for the invitation. Now, can I have a show of hands? Who here is in private practice? All right, so about a quarter of the crowd. This is something that has started to take hold in private practice. It emerged from private practice. So it has always clashed with the academics because they didn't quite understand it. It didn't come up through their ecosystem. And they're accustomed to having a say in the birth of every great aspect in our specialty. So there has always been this clash between the cosmetic gynecologists and the academicians. But as time goes by and as these procedures become more widespread and information about these procedures becomes more easy to access, I think everybody in the specialty has an idea of what types of things are being done. But you want to hear it from somebody who's been doing it for a long time, and the particular issues that are unique to cosmetic practice that you may have never considered. I am owner of the International Society of Cosmetic Gynecology. We train doctors to do these procedures, so that's my conflict of interest. I have a very positive spin on this. Let's get going. This lady showed up at my office with her mom. She's 17 years old. And she doesn't like the way her labia look. She has no gynecologic symptoms. This is a pure aesthetic request. No place to hide for the gynecologist. You can either say, thank you, I'm not interested. Maybe you have something wrong with the way you feel about your body. Or, yes, we have something we can offer you. So you might write it off as a 17-year-old, very impressionable, really doesn't know what she's asking for. Maybe you shouldn't acquiesce the request. Here's another lady, 55 years old. Same request. She's a lawyer. She just wants this to look better. And she is aware that these procedures are available for her. And she's making a choice to change her appearance. This lady is 23 years old. She's going to get married in a traditional way in her country. Happens to be that the traditional way is for the hymen to break on the wedding night. And if it doesn't break on the wedding night, she will be ostracized in her culture and be unable to marry in the fashion that her sisters did, and her mom did, and her aunts. And it may seem trivial to you, but to her, this is part of the marriage process. So what do? Do you acquiesce, or do you say, no, thank you, I'm not interested? This lady had the same request. She's 30 years old. She's an architect. She's a professional. Same request, same cultural need. What do you do with this? Here's another lady, mid-30s. She's very fit. She's actually a fitness instructor. And despite all of her fitness, she feels lax in the vagina. There's no clinical symptom. There's no stress incontinence. There's no prolapse. There's no real rectocele. There's no issues with her bowel or bladder functions. It's just a little bit loose, like most women who have gone through childbirth. What do? You say, do some Kegels. You know they don't work for this. She's already tried the Kegels. You say, you can either acquiesce or you can pass it on to somebody else. But these people are out there. And the danger is that the person who acquiesces may not be a gynecologist, be a derm, a plastic, a urologist, somebody who's not as familiar with the anatomy, who doesn't work on it every day as you do. And you can say, well, ACOG says this, and I love ACOG, and I don't want to go against ACOG. So we're going to go into what ACOG actually says. And after years and years of things that have evolved after they have said certain things, where the status of these concerns presently lies. There's a whole bunch of procedures that are being done. I'm going to focus on the most common ones because they come up the most in discussions. The Vaginoplasty, the Labiaplasty, the Hymenoplasty, and non-surgical interventions, which is something that has come up in the last couple of years. But this has the potential to attract many more people. Now, what's unique about these procedures is that they are primarily office-based. Even the surgical procedures, the vaginoplasties, are typically done with pudendal blocks, local anesthetic infiltrations. My very first few labiaplasties that I ever did, I put them in the hospital, did them under general. And there wasn't an issue on my side of bringing a patient into the hospital and doing gynecologic-based procedure. The problem was with the privacy of the patient. She had to check in at the front desk and tell somebody she was having a labiaplasty, and that person would make a face. She had to go into the pre-admission area in the OR, and all the nurses whispering behind. This is 20 years ago. Whispering, she's having this done. Isn't that strange? In the post-operative care, the wacko in bed 5 wants a painkiller. After an experience like that, that woman is traumatized just by being served in a clinical setting that normally shouldn't have any kind of bias attached to it. I pulled them all out of the hospital. I brought my anesthesiologist to the office, and I did them there. I said, I'm never going back to the hospital and subjecting any of my patients to that ever again. So these are office-based procedures for good reason. Now, they're also cash-based because there's no medical need. You cannot find a single diagnostic without stretching the truth that's going to cover a purely aesthetic request for a labiaplasty. It's not a birth defect. It's not cancer. It's not a tumor. It's a normal structure. So these are all cash-based. And you might say anytime cash is involved, your judgment is clouded. You're going to over-recommend procedures that don't need to be done. And sure, the potential for abuse is undeniable. But if you're in this and you're serious about it, the reputation will follow you. So, you choose how you want to approach cash-based services, and if you do it properly, there is no issue with that. These are lifestyle issues. These aren't medical problems, and you're really not trained. You open a textbook, you don't see a lot of this stuff. It might be a sentence. It might be, it's beyond the scope of the chapter. It's stuff we normally wouldn't deal with coming out of residency. We have no background in it. So we feel a little bit out of sorts. So one of the issues has been operating on normal anatomy. Okay, we're always told if it's normal, leave it alone. If there's no problem with the structure, if it falls within the range of normal, it doesn't need to be touched. And then the other problem is it's not medically indicated. Of course not. It's not a medical request. You're not fixing a medical problem. But you do have a background in operating without medical indications and on normal anatomy. If you think about it, what do we do every day? What's wrong with the tube when you do a tubal ligation? What disease are you curing? You have birth control options galore, but you're choosing to operate. How about this? A circ. Sure, there could be medical benefits. I can pull you out a study that says in a little piece of Africa, in this third world culture, it'll reduce the rate of HIV. Is that the reason you did it? No, you did it because the mom asked. How long did you take spending on consent process there? Just sign right here, Mom, and we'll do your circ. What if the mom wants a labiaplasty? Now you have a problem? It's okay to chop the kid. He doesn't even get a say. How about this? What's wrong with the uterus? Nothing. That's a TOP, if you're having trouble seeing. It's a request. So if that woman wants a labiaplasty, is her request for that any more of a jump. It's basically a request. You might ask, why are people asking for these procedures? I've been in practice 20 years. The requests were very rare 20 years ago. People with 30, 40 years in practice would say, when I was in training, we never saw this. So what's wrong with people? Something has to be creating this need, because this is not normal to request these things because they never requested them before. So we start throwing up ideas. Is it that we can view the genital area now because shaving is in fashion? Is it because every time you turn on a TV or a device, you can't get away from this stuff? It's going to pop up somewhere. Is it porn? All of these things come up. Nobody really knows which one is responsible, if they're all responsible, if none of them are responsible. But everybody with a cause seems to take a bad one and twist it to make their point. I think one of the main reasons, irrespective of all this stuff, is that there is access to information that wasn't there before. You got kids, I have kids, they live on their phones. You look in your waiting room, every patient's on their phone. It used to be 10 years ago, 15 years ago, if you wanted internet access, you needed a laptop or a computer, something big, clunky, heavy, and out of the price range of a little kid. But now you have a whole culture of people who are conditioned to just search and share and relate. Every kid can become an expert in everything. My little daughter has a fish tank, and she can build the motors just because of internet access to information. So everybody knows what procedures are available, where they're available, how they're done. They can even see video of the actual things. So the first response I get from people is, how did you find out that you wanted to do this procedure? There's Labiaplasty, Vaginoplasty, or Hymenoplasty. This is what some of them say. I never knew this could be done. But now that I know it can be done, this is something that I wanted done because it's curing a lifestyle issue for me. So that's basically where this demand is coming from. Access to knowledge. There's this latent need that nobody knew existed because first, who's going to ask? You don't ask gynecologic patients about cosmetic issues. It has nothing to do with medicine. So let's delve into cosmetics in general, because when people look at the area and decide, I want it to look a certain way, well, how do they know that that way is the way that looks good or looks bad? All right, show of hands. Who wears makeup in this room? Why do you wear makeup? Why don't you just wake up in the morning out of the shower and just go to work or come to the meeting? I'll tell you, you want to improve your complexion. Well, what does an improved complexion look like? Does it look red and blotchy? Does it look wrinkled? It looks smooth. Smooth like what? Like a young person. Whoever wore braces, who's wearing caps on their teeth right now? Show of hands. There's a few out there. What's wrong with crooked teeth? They're not symmetrical. What's wrong with asymmetry? Well, asymmetry is a marker of disease, that somewhere along the growth and birth process, something didn't work out right. So that's not appealing on an instinctual level. People like symmetry. Who colors their hair? Okay. People who color their hair didn't color it gray. Why is that? It's because you want it to look a color that it looked when it was younger. There's something about human nature that loves youth, symmetry, healthiness. And this has gone back since the beginning of time. Every culture, regardless of what they like specifically, they value beauty. But they all share common factors of beauty, regardless of whether in some cultures, it has to be a certain volume attached to this. The values are the same. This is a statue that was found from 33,000 BC. A piece of art. What did they like back then? Big boobs, big butt. Has anything really changed? No. The proportion isn't straight. It's got sort of an hourglass figure to it. So going back to the Stone Age, there's already something in there that the artistic representation of the human form, there are certain elements that are desirable. We have, with the Egyptians, the love of symmetry, the love of smoothness, complexion, proportion. We have, with the Romans and with the Greeks, the same thing, the very same thing. You can use that female form in any generation. So the values of beauty and youth go through all cultures, and they always have. This is before the media. This is before cell phones. This is before advertising. This was just out there from these cultures. Aesthetics is a word which relates to the sensory perception of what we see, we feel, we taste. We apply judgments to these things. What comes in through the senses gets assessed in terms of beauty. Why do we do this? Why do we even bother? Why do you straighten out a crooked painting on the wall? Because it bothers. Why does it bother you? Because deep down in your brain, there's something in the subconscious that says it shouldn't be that way. Our bodies evolved to maximize the survival of the species. Did you think the brain wouldn't evolve as well? The way that we think and behave. Does it evolve? Nobody likes to think that the way that you think is pre-wired. It undermines every social program. You can't rehabilitate a criminal if they're hardwired to be criminal. So, really, you can't say it's all or nothing, okay? It's not all nature. There's a nurture element. Think of it as software, okay? And your nurture is a new program you just bought. It runs pretty well on some machines. It doesn't run so well on other machines because there's tendencies. There's ways that people like to think in the natural sense before they apply their intellect. But it's out there. And this is what affects what you're not thinking about consciously. So it's theorized that our behavior has evolved to maximize the survival of the species. And this is a leftover from the Stone Age. We don't need it anymore. Once humans started farming, okay, you didn't have to hunt anymore. So all of these hunting instincts, you have to find something else to do. So sports were born, people go to wars, all kinds of substitutes for these instincts to be squeezed out of the body. And this whole field is called evolutionary psychology. And it's very, very interesting stuff. I mean, you should Google it and, just read a few books on this stuff, because some of these things that we do every day can be explained as processes that somehow would help us to have survived through the Stone Age. And what it favors is thinking processes that maximize reproductive potential. If you ask 1,000 men to rate a woman and you have photographs of her at every age in her life, they will consistently pick the age as most attractive that matches her maximum reproductive potential, which is usually about 16. And women will do the same thing. So there's something in our behavior, in our DNA, that helps us to pick out reproductive potential. And a surrogate for reproductive potential is a healthy complexion and features of youth. This goes back to the cosmetic gynecology, because when a woman looks down there and says this doesn't look right, she's applying those same factors into how she assesses this. When you go in your house and you arrange furniture, okay, the symmetry, that's all in there. There's reasons why we think that way. So these are not arbitrary. They're not created by the media. They're not created by porn. They're not created on the internet. These are human values that have always been there. This is what it's saying. Okay, I'm fertile and I'm healthy. And it doesn't matter if you can find exceptions to this rule. There are people that don't have kids that are perfectly happy. There are people that, are attracted to unreproductive appearances, and they're just fine. But 2/3, 3/4 of the population, this gets passed on. Okay, the species survives. And that's just nature. Now, since this is an academic conference, I'm going to throw some data at you, some papers at you, just to show you that it's just not me talking about this. And studies have been done. And in psychology, Michael Cunningham did a study. He looks across cultures, and he shows pictures of a culture that's not the culture that's being tested or analyzed, and they all pick out the younger people with the smooth skin, with the fertile appearance consistently. And these studies were from the 80s. This is before the internet, before globalization. There's another one. Intraracial versus extraracial judging of attractiveness from the Journal of Anthropology. Another one. Now, these are a few that are widely quoted. So complexion, symmetry, and youth. It's all through history. Middle Ages. Okay, one culture. Another culture. Another. They all have in common. Great skin, great hair, youth, and symmetry. Now, here's some interesting research. They took infants, and they showed them pictures that were rated as attractive by adults. And when an infant is interested in something, they measure it by how long the infant stares at it. They know they have a short attention span, but when something grabs their eye, they look. So they showed them these pictures. And the infants look longer at the attractive faces. Kind of strange, isn't it? And interesting. This has been done multiple times. 1 week olds, 1 month olds, 3 months olds, no language skills, can't operate a cell phone, can't be influenced by the media, just, newborns right out of the oven, they stare at the attractive people longer. The ones with more symmetry, with a better complexion, with a more youthful appearance. There are exceptions, okay, if you're a grandparent, okay, there's exceptions, don't worry. But this has been studied, and the big cheese in this research is Judith Langlois. And she's written more on this than anybody. She's wrote it back in the 80s, but this is landmark work in the perception of beauty. So when that 17-year-old comes into my office, I can understand that the request may have been clouded by media. She may have body dysmorphic disorder, but these are all things, checklist items in the back of my head that I'm screening for. But the majority of the people that are requesting these procedures are doing it from a purely aesthetic preference. Now, even if you have the preference, if you look at national statistics, there's about 10 to 12 million cosmetic procedures done for all cosmetic issues in the country. And there's about 300 million people in the country. So if you take that, it's a 1 in 300 chance that somebody wants to act on a cosmetic request. So there's a lot of people that think about it, but there's only a few that are actually going to act on it. It's not a lot of people. They seem to congregate in my office because they know I offer these services. But this is a human nature. And here's another interesting, just a juxtaposition. When you see a picture like that, okay, you see something wrong with it. There's an imbalance because that's not the natural attraction. She shouldn't be attracted to him. He should be attracted to her. Because what? Because she's not attracted to somebody who is evoking good complexion, good symmetry, good youth. You're a Patriots fan, okay? Good for him. But it looks wrong, doesn't it? Now, his wife died of cancer, so don't feel that bad. That's Bob Kraft. If we go to what people have said, the media created the need for labiaplasty, it's not true. The media just puts it up there because they know people will tune in because they're attracted to that stuff in the first place. So the media doesn't define beauty. Advertising. Advertising a product, okay, a little box of cigarettes. If they put a picture of a box of cigarettes there, nobody's going to look at it. If they put an attractive woman on the picture, now everybody's going to look at it, and now they have the attention. Advertising is all about getting attention. They look at universal valve caps. If you put a picture of whatever that is, nobody's going to look at it. If you attach a woman to it, everybody's staring at it. And don't think that the Green Journal is immune. I pulled these out of the Green Journal. Yeah, Patty wants to have an IUD. Well, why does she have to be young and have nice features and be pretty? And why does the patch have to be put on a buff, sculpted abdominal wall? What's the deal there? Green jerky. Because it attracts the viewer. What do these girls have in common with beer? Nothing. Beer is in a bottle. These girls are just sitting there with this label painted. Why? Because nobody's going to look at a beer bottle. We learned this with dogs. If you take something that a dog likes and make a whistle sound, sooner or later, the whistle sound will get the dog just as excited as the food. All right, so that's what advertising is all about. Get your attention and just hack your instincts. Who would look at that? When you have the other criticism of the media is, well, they're always putting up, these super pretty people, so everybody thinks that everybody should look that way, that, when they talk about the tight bathing suit, everybody should be looking the same way in the tight bathing suit. It's all about getting attention, and since they compete with each other with attractive images, they get more and more attractive, and they get away from the population mean of attractiveness. But the population is still attracted to the same thing. The want is still there. It's just to make somebody tune in on the media level, they have to catch your attention. So yeah, you can be overexposed to the media. You could be underinformed, but typically there's a lot of instinct involved. Cosmetic means adornment, like tattoo, body art, all that stuff. It's all related. Our role. The doctor shows you that beauty is something that you can participate in. Now, we have something we can offer you. And like I said, no matter who you ask, whether it's a physician, a patient, an opponent, some people love cosmetics, some people hate them, but as a culture, we tolerate it, and in general, it's a very accepted intervention for many things. So, these are or some of the things that have been said about these procedures. Some say that it's, the culture. Well, who created the culture? The people. With what? Their instincts. So we have the opponents. And I think we've hammered, some of these points pretty well, that cosmetic gynecology wasn't created by porn. Porn industry is just another industry just looking to have more viewers. And if they put young, attractive people in their porn, more people are going to tune in than if they have older people who don't look as nice. So it's all for them. It's a business. It's just about getting more viewers. Some people say, well, in the previous generation, my grandma would never have gotten this. I'll bet if your grandma had a cell phone and we brought her back in time here, she'd be right up there with everybody else because she has access to information. Remember, I never knew this could be done. But now that I know, I'm going to start thinking about it and see if this is something that applies to me. And some people say these people are crazy. Some of these people are crazy. But body dysmorphic disorder is something that afflicts about 1 to 2% of the population, depending on who you read, in the general population. If you put up a sign and say, I do cosmetic surgery, you're creating a magnet for some of these people. So in a cosmetic practice, it's probably about 10%. So you really have to bone up on the knowledge of what this condition is. It's an obsession with a body part that can't ever be cured by surgery. The real risk is that these people have a 40 times normal suicide risk. And you don't want to get into that path of, this spiral. So you have to know some things for screening. Just like anything else, you know how to screen for every other disease in gynecology. Well, this is something else you can learn. But it's not a sign of insanity. So we can agree that standards of beauty exist throughout the world, and there is an inborn element from these infant studies. So let's take it back to the cosmetic gynecology. You go into some of these procedures. So we can say that, it's okay to do a tummy tuck, but to do a procedure a few inches lower might be an issue. It's not. It's the same issue. This is an artist in England, Jamie McCartney. He wanted to promote that normal variations exist in the vulvar anatomy. So he got women to get casts done of the vulva. and he put them up on these walls in a museum. You can go to London to the museum, and there's walls and walls of vaginal casts. Well, that just shows you the great variety of what's normal, but what people think about their normal varies from person to person. You can have identical twins who think completely differently about one thing or another on their body. So that being said, the existence of variety doesn't invalidate any cosmetic request. Most of the criticism of the cosmetic surgery, and this is information that has appeared in ACOG documents on cosmetics, comes from the British. Now, the problem with the British is they have the national health system. So anything that gets operated has to be paid for by the National Health Bank. So people stretch the indications. So they use medical indications for labiaplasty. And so the establishment gets all upset because these dollars could be better spent somewhere else. But those are criticisms of just abusing the system, not really of the procedures themselves. Yeah, sure, I would have the same issue if you tried to game the insurance company to pay for a labiaplasty. That would be wrong. Other criticisms are that these procedures lack long-term data. Well, it depends on what you're talking about and what kind of data you're asking. And we're going to get into these in a little bit. Efficacy is unknown. Well, it depends on what you're measuring and might be dangerous. Oh, this is just dramatizing stuff from procedures that really have nothing to do with cosmetic. We have enough data from asking patients. You don't do randomized studies and sham treatments in the world of cosmetic surgery. It just wouldn't fly. How would you know you had a labiaplasty or you didn't? You can't tell a woman whose labia shape changed that she didn't have one. And every procedure in cosmetic gynecology has a step in regular therapeutic gynecology. I can pull them right out step by step and show you this is a piece from this procedure that's done for cancer. This one is done for incontinence. This one is done for this. This one is done for that. There's nothing new in the surgery, in the anatomy. It's just how you apply it. So let's go into vaginoplasty. Elective tightening of the vagina. Patient says, I feel loose. Well, it requires a clinical exam. If it's not loose, then she's wrong. There's not much to do there. But if it's lax, you can fix it. And how do you fix it? Well, it's basically the same anatomy, the same techniques, the same suture material you would use for posterior repairs. A vaginoplasty is essentially a posterior repair that always includes tightening of the musculature at the levators and always includes a perineoplasty. It's not a rectocele repair, but if you're doing a rectocele repair, you'd be looking at the same anatomy and just throwing your stitches in slightly different places. This is from Robert Latu Dickinson from 1929. He was the first to take detailed sexual histories of his patients, over 5,000 of them. And he predated Kinsey. So Kinsey studied all of Latu Dickinson's work. And the guy was also an artist and a sculptor, born in Jersey City. And, he did all this breakthrough stuff, just analyzing the act of sex anatomically in every aspect. The first recorded attempts to tighten the vagina were in Italy, in Padua. 1000 AD. They would put substances in a cloth to try to constrict the vagina. I don't know how well it worked, but it was written in those books, which have since been translated, that it was all for improving the quality of sex. That's 1000 AD. Arnold Kegel did extensive work on this. Everybody thinks that Kegel was just about, childbirth, but it was more of a sexual side to it that he also wrote about. So, vaginoplasty, I don't really think differs much from posterior repairs, so to say that it's dangerous is really out of whack. How bad could a posterior repair be in a worst case scenario without mesh? Not that bad. And these are healthy people. They're not getting the same degree of a posterior repair that you would use for a huge rectocele. We're screening out, since it's cosmetic surgery, no diabetic, no poor healer. You get to pick the patient. Labiaplasty? Well, now, labiaplasty is a procedure that does have some therapeutic benefit to women who have issues related to pain, but from a purely aesthetic standpoint, it's the same operation. It's just the loose skin external to the body. It doesn't have a risk of pain or nasty scarring unless you overdo it, unless you're comparing it to a vulvectomy, but it's not any of that. Now, labiaplasties go back to 600 AD. Basically, in those times, anything that protruded and that hung down very long, whether it was the clitoris or a labia, was considered an abnormal sign of some disease. They would just pull on it, put a clamp across it, and cut it off. So it's kind of cruel and totally something out of whack with what we would do today. But that's the origin of the surgical intervention. It was for appearance. Their motivations might have been off the wall. Pierre Dionis, surgeon in the court of Louis XIV, wrote about labiaplasty. Heister, a German soldier who was a surgeon, wrote about this. Philadelphia, in 1905, Hearst, who wrote one of the big textbooks of the day in gynecology. Jeffcoat, in the 1950s, all of them wrote about these procedures. They're not new. Now, when labiaplasty was criticized in a statement by ACOG in 2008, it was a committee opinion, and there was only one reference. The reference was written by Naomi Couch, who is a British reproductive endocrinologist who has a long history of anti-cosmetic surgery articles. And her reference that said that there was pain and scarring and disfigurement referenced a 1970s study of feminizing genitoplasty, which is an operation which is very extensive, which you do when you have ambiguous genitalia in a newborn and you want to make it look female. What does that have to do with labiaplasty? Zero. I might as well just pull out an article that says radical vulvectomy and radiation hurts afterwards. It has nothing to do with a labiaplasty. Yet, that's what we're dragging in when we put that little sentence that says, it may have pain, it may have scarring, it may have disfigurement. Well, yeah, your example for a reference did, but this is not the same. This is apples and oranges. There's also the misconception that it's a quick and easy 5-minute procedure. This is what's going to get you in trouble if you try to do one without knowing what you're doing, just because you think it's easy. Well, yeah, it's easy to grab some tissue, put a clamp across it, and sew it. It doesn't take more than a second. But it's not going to look right, it's not going to feel right, and it's definitely going to not result in something that's aesthetic. So labiaplasty is a 90-minute procedure most of the time. It takes a long time to make this stuff look normal and aesthetic. So if you think it's quick and easy, it's really far from that. These are just, my average operating time is 60 to 90 minutes. Gary Alter, who's plastic and urologist, well known for doing certain techniques in Beverly Hills, spent 60 to 120 minutes, and he's published large studies of numerous patients. And Dr. Matlock, who you may or may not know, is the first doctor to promote these procedures, 60 to 90 minutes. So they take a while. You have to really take your time. So if this is something you want to do and do it well, you really need to take the time to do the procedure, to learn the techniques. More importantly, to learn how to counsel the patients about expectations, because it's not black and white. They want something, and your goal is to get as close to that something as possible, if that is a realistic request. And I think, this has been beaten to death. Falling within the range of normal invalidates the cosmetic request, which was the essence of the ACOG committee opinion. Well, what about breast augmentation, a nose job, straightening your teeth, putting paint in your hair? Okay, we're going against normal. So cosmetics has always been about normal. And just because you can measure something and say, well, it falls within the average, doesn't mean that it's where the patient wants to be in the normal range. She wants to be in a certain, in her mind, ideal range. So it's a little hypocritical to say, okay, it's okay for the anatomy to vary, but it's not okay for you to have a different opinion of what you want to do with it. Hymenoplasty. Now, this is a tough one. The counseling that goes into a hymenoplasty is a tough one. Patient comes in with a cultural request, and her goal is to bleed on her wedding night. There are many women who, when the hymen breaks initially, never bled. If you take a microscopic section of the hymen, what you see is very few blood vessels. But it varies from woman to woman. So if they didn't bleed when it broke the first time, when you reconstruct the hymen, there's not too many blood vessels there to begin with. The odds that it's going to bleed again aren't so good. So you can't predict. So I can tell these people, I can reconstruct your hymen and it's going to break. But after that, whether it bleeds or not, nobody can guarantee that. So that's what goes into an expectation for a procedure. But if you promise them it's going to bleed and they don't bleed, you have a problem. So I can tell people the hardest part of the hymenoplasty isn't the procedure, it's the counseling you do beforehand. Let's take a look at this guy, David Matlock, MD, MBA. He was the first guy to advertise vaginal rejuvenation, laser vaginal rejuvenation. Matlock, who I know very well, did a few posterior repairs for gynecologic indications where the patient said, my sex is really good, it's changed, it's better. So a little light bulb went up into his head. He put a little ad in the paper in 1996. In 1998, he got an MBA, and this was his project, to create a business model out of this. And 2000, he started the Laser Vaginal Rejuvenation Institute of America, a franchise, where you would pay Matlock $50,000 up front and $2,500 quarterly to be able to use the name, and he would teach you the procedures. And you had a gag clause. You couldn't train anybody. You couldn't show anybody what you were doing. This really pissed off the establishment. They said, this knowledge should be shared with everybody. And he was just looking at it from a business angle. He goes, no, it's intellectual property. IBM doesn't tell Microsoft what it's doing. And I'm not either. So I'm going to speed up a little bit because we're on the edge of the clock here. So basically a committee opinion came out attacking Matlock's nomenclature and the secrecy behind the procedures, and this sort of spilled over into labiaplasty, vaginoplasty in general. People were afraid to do them, and the only reference in this committee opinion was an article that said that the article that he used as a reference that female genital appearance varies by this Naomi Couch. And there was nothing to back it up. That was the essence of what ACOG said. They didn't like his business model. They didn't like that he used strange nomenclature. And they said, based on what we have and behind this secrecy wall, we can't say anything about any of these procedures other than that we don't know what they are. They might be unproven. They might be proven. We don't know. So I'm going to kill it right there because we're out of time. And I didn't have time for the non-surgical, but I hope you have a little bit new perspective on this part of cosmetic surgery. Thank you.
Share this podcast and this website and this blog with the people in your life who you feel would benefit from this information. Thank you.